Hello, my name is María-Victoria Mateos. I work as hematologist and director of the myeloma unit at the University Hospital of Salamanca in Spain. And I would like to discuss with you about which patients would be the ideal candidates to be included in a clinical trial of smoldering myeloma. Smoldering is basically defined by the presence of a monoclonal component in serum of at least 3 grams per deciliter and or a plasma cell bone marrow infiltration between 10 and 59%. And most importantly, no myeloma defining events have to be present. But under this common definition, smoldering myeloma is a very heterogeneous disease, and we can identify patients with a very low risk of progression to multiple myeloma, patients with intermediate risk of progression to multiple myeloma, and patients with high risk, in which we know that the median time to progression to myeloma is of approximately 2 years. So the first important thing is to stratify smoldering myeloma patients according to the risk. If I have to design a clinical trial in smoldering, you can imagine that if we plan a general trial including low, intermediate, and high-risk smoldering myeloma patients, maybe I am not going to get any significant benefit because maybe high-risk patients could get a benefit, and this benefit is going to be underestimated by patients with low-risk smoldering, in which the probability of progressing to myeloma is 1% per year. This is the reason why the trials that are being conducted in smoldering myeloma are basically focused on high-risk smoldering myeloma patients. So those in which we know that the progression risk at myeloma is 50% at 2 years. It's true that some clinical trials have also the possibility to include some intermediate risk smoldering myeloma patients, but basically, if you go to clinicaltrials.gov, there are right now more than 50 clinical trials ongoing, and almost all of them focus on this high-risk population. And the possibilities are basically based on lenalidomide and dexamethasone plus a third agent, a monoclonal antibody or a proteasome inhibitor like ixazomib or carfilzomib. Also monoclonal antibodies as single agent, daratumumab or isatuximab, but also there is another possibility, a curative approach for these high-risk smoldering myeloma patients, basically based on including multi-drug-based combination with proteasome inhibitors, IMiDs, and even anti-CD38 monoclonal antibodies, and including autologous stem cell transplantation. All these trials are ongoing. The solid data we have right now are coming from lenalidomide and dexamethasone in high-risk smoldering myeloma patients, but this is the ideal platform to conduct a lot of clinical trials that most of them are ongoing, and in the near future we will have relevant information for the management of smoldering myeloma patients in general, but especially in high-risk smoldering myeloma, because maybe the early treatment will result into a significant benefit, not only in terms of delaying the progression to myeloma, but maybe in order to offer them a potential cure.